Hello, my name is Colin Yard, and I'm going to be talking about my research, a retrospective review of disease activity in patients with SLE based on health insurance. So, it is a well-known fact that lupus predominantly affects women, and specifically women of color. It also disproportionately affects those of lower socioeconomic status. So, with this in mind, one more potential gap in healthcare could include coverage of certain treatments according to which type of insurance the individual carries, either public or private insurance. So identifying any discrepancies in this could help shape policy and resource allocation. Therefore, we conducted a study in an Appalachian population investigating whether disease outcomes vary between those with private or public health insurance. So, how did we do this? All patients were seen at an academic rheumatology clinic in Appalachian, Tennessee with an ICD-10 diagnosis of lupus. Only those with an ACR or EULAR classification criteria for lupus were included. So, from the most recent visit, the team calculated the SLE damage index and the SLEDI-2K score for lupus. So, the SLE damage index is essentially a number assigned to the damage accumulated over the time that the patient has had lupus. So, it's an accumulation of the damage throughout their diagnosis. And then the SLEDI-2K score is a measure of the disease activity at any certain time. So in this instance, it'll be their most recent visit. And then public or private insurance was determined at the time of the most recent. Public insurance being Medicare, TennCare, or TRICARE. And then independent samples t-tests were then used to determine differences between insurance. So a total of 57 patients were identified. And of those, 29 met classification criteria for lupus. Of those 29, we then split them into 16 who had public health insurance, and then 13 who had private health insurance. And then disease duration was either unavailable or unclear in 5. This means and standard deviations for each insurance group related to SLEEK damage, SLEDI-2K, length of disease, and age are shown in Table 1, if I may direct you to the bottom of the screen. So here you can see that there are no differences related to either SLEEK-DI or SLEDI-2K between the public and private insurance group. Then you'll also see that we attempted to control for length of disease and age because, as you know, having any disease for any length of time will accumulate more damage. And specifically for lupus, more specifically the SLEEK-DI, the amount of time that you've had lupus will result in a higher score, so we wanted to control for that. As you can see here, the length of time that the patient has had lupus in either category, public or private, is similar in both length of disease and age. So, in conclusion, at our academic rheumatology clinic serving Eastern Tennessee, we found that there were no differences in lupus outcomes as measured by the SLEEK-DI and SLEDI-2K scores between those with public and private health insurance. This shows that there is some preliminary evidence that patients with lupus are well served in Eastern Tennessee, regardless of having public or private insurance. So, where can we go from here? Essentially, this provides opportunity for other researchers, other investigators to see if there's any correlation in public or private insurance in their own region. And then we can have some more opportunity to dive deeper in this if there are some potential correlation. And here I've included some references to both the SLEEK-DI articles and the SLEDI-2K activities. Thank you.